This is a friend I've known for a long time, I think 15 years.
Mm-hmm.
And he, at that time, was a Rolfer. And then he decided to go to PT school. So he graduated about a year ago, happened to move from Florida up to this community. And he asked me to treat him. And so we had a session today. And I thought that I would have him just give a summary of what we did, and we would start with the tailbone. Wasn't that the first thing I treated?
Yes, it was the
Yeah, so
tailbone.
just give us a little bit of what your experience was.
So before coming today, I've had some chronic issues with my body for decades, and today I was feeling I've had some chronic low back issues with my sacroiliac area, my thoracic and cervical spine, so my mid back, my neck, and my shoulders, specifically my left shoulder, and so today, in today's visit, we found that I had a coccyx that was side bent and rotated. We found that I had a rib that wasn't moving well on the left side, I think with my seventh rib. We identified that I had dysfunction at my OA joint and also my left first rib. Those are the ones I can recall right now off the top.
Yeah,
of my
your
head.
rib was really unique because it was compressed anteromedially, and you're in the 2%. Most of the time it's pulled posterolaterally. Most people don't know that. They think that the rib gets pulled up by the scaling muscles, but they don't evaluate medial lateral play,
Sure.
anteromedial, posterolateral. But I've been doing that forever, and they can have the other treatments still have a restriction, and it's just very, very helpful. And your rib was compressed anteromedially.
So when we released the rib, everything, but when we released the rib especially, and my cervical spine and my OA area, I felt a tremendous release of tension in that entire area, and in my entire back, actually. And when I stood up off the table, for the first time and since I can remember, I felt like I could stand without feeling tension pulling me in one direction or the other, and back pain coming from my hip and SI joint coming all the way up my spine. So I felt a release of tension in the entire spinal column, from the OA all the way down.
And you talked about your center of mass.
Mm-hmm.
What did you say?
So yeah, so I felt like my center of mass for the first time, again, since I can remember, I could stand where it was actually centered and not pulled off of center. So I felt like I could actually stand at ease.
And we did a treatment to the atlantoaxial joint. You had a flexion, compression injury there.
Yes.
And that's rare. That's in the 5 or 10% of people, you know. I don't see that very often. And how did you respond to that?
Yeah, I feel like that may have been all the way back to the time when I was 12 years old. I was mentioning I fell off of a motorcycle, and that has been there ever since. This has never been treated. So I felt incredibly light in my neck and my head. I felt like circulation rushing to my neck and my head when I stood up. And now it just feels light, and I'm able to move in all directions without pain.
And I told you most of this work is once and done.
Yes, you said.
What does that mean to you?
It means that there's actually, this is amazing, there's a good chance that it won't return back to the way that it was. So yeah, I am incredibly grateful.
Yeah, I found if you use correct mechanics of the joint and the oblique restriction in your occipito-atlantal work, you went through Stanley Paris's process. You just need one more class for certification in manual therapy, am I correct?
That's right, yeah.
You got your degree through that university.
Exactly.
So you're deeply steeped in manual therapy, but they didn't teach you how to treat anomalous anatomy at the OA joint.
Right, yeah.
And you had what I call an oblique restriction, which is present even after restoring rotation and side bending. So it's a different axis.
Yeah, yeah.
And I've dug into the anatomical literature, and I've dug into the anthropological literature. And I would say that perhaps as many as 30% of the population have anomalous anatomy side to side at the OA joint.
Sure.
Second only to the lumbar, to the L5S1. So you had that, and we treated it, and that should be a once and done. Of course, I'll bring you back in 2 weeks, and we'll check everything.
Sure.
You know, and I also like to, on the second visit, look for anything I could have missed or anything that might emerge. Sometimes that happens.
Oh, okay.
Yeah. So, yeah, I'm pleased with your results. I look forward to getting feedback from you. And
Absolutely. Yeah. With everything I've done before and all the things I've trained in and learned, this was unique. So I'm really happy that I had that experience. And
very good. And what is unique about this approach?
A lot. The way you evaluated and treated with the specificity, different techniques, and also the slow speed with which you treat and hold the techniques as you do them is different than the way I've learned them.
Yeah, I held them for 2 minutes or 3 minutes, and for some joints 5, and there's one pattern in the body that I do a hold for 10 minutes.
Wow.
You know?
Yeah.
But honestly, it's usually once and done. And now, you know, let's say I restored somebody's hip extension, okay?
Mm-hmm.
Well, now every time they walk, their hip finds that new extension.
Mm-hmm.
So if I taught them nothing, a month later they'd still have that gain of hip extension. The body likes normal function. The body likes correction, as a friend once told me.
Yeah.
And it's,
so it's able to still find
yeah, normal movement self-reinforces these
Mm-hmm.
corrections.
Yeah. Makes sense.
So anyway, it's called the Hesch method. I take a lot of flack on social media, you know, and I'm going to do more writing. I have 3 book chapters. I wrote a book. I have a workbook on the whole body. I've trained more than, I estimate, just under 10,000 clinicians.
Wow. Wow.
And we will certainly train more. And I like it because it's simple, it's straightforward.
Yeah.
I let the body do the talking. I don't tell the body how it has to behave. You know?
Sure.
And there's a lot of people grabbing things like, oh, you don't need specificity anymore. I'm like, whoa, slow it down. You mean such as a thoracic or a lumbar manipulation, you cannot say, I just popped the joint at C4, C5. You can't do that. It could be the one above, the one below. What's important to me is that I find the restriction in the joint, whatever joint. And if I'm off, if I say C4, 5 and it's another level, I don't care.
Sure.
It's not the end of the world. So I'm imprecise. But I found what was stuck, what was inhibiting muscle. When you have micromotion that's lost, it's stuck.
Yeah.
You will have neurologic inhibition of the muscle. People can do the stabilization exercises for 3 months. They walk in the door every week. I'm like, look, you're still weak. I say, but it's not weakness, actually. It's inhibition.
Mm-hmm.
So we remove that inhibition, you know, and it's an effective technique, and oftentimes it's once and done, and bring on the critique, you know, bring it on.
I can also say that it feels so comfortable while you're performing a technique.
Nice.
And there's no sense of jarring. I didn't have any, I mean, I've had thrust adjustments, I've had all kinds of things with manual therapy with my body, but this is something where I feel that it's comfortable while you're doing it, and it just improves over the time you're holding it.
Nice.
So it's very, it's a pleasant experience.
And the body's not intimidated, so it doesn't go into protection mode.
Yes, that's exactly
Yeah.
kind of how I could feel, where there was no guarding, there's no muscle guarding happening while you're doing that, no sensations of discomfort at all.
Nice.
So
Yeah, and like your Atlas, I treat it very close to neutral.
okay.
I don't care about all the studies that say, you know, you can manipulate the upper cervical and it's fine and it's safe and it doesn't this and that. I don't care. I will never extend and rotate a neck and try to create a pop.
Huh.
I treat it close to neutral
Close to-
because that's all I have to do,
Got it.
you know?
Yeah.
So we need research. We'll get research. It'll come in time.
Mhm.
I am going to take 2 weeks off of every month in the new year and I'm going to work more on getting the word out,
Mhm.
fostering research. I'm going to contact people. I see a lot of good
That's great.
PT
Yeah.
research coming out of Korea. It'd be nice to work with somebody who's hungry to take
Sure.
on research projects. I'm not a researcher. I got to learn how.
I think that'd be great.
Yeah. And I had severe injuries before age 21. So, and I sought manipulation. I've had it by several different practitioners, chiropractors, osteopaths, physical therapists. It never did anything for me. My body just doesn't need that.
Right.
I have very dense connective tissue, made me a good wrestler,
Sure.
but
Yeah.
not a good candidate for an injury, because then I tear ligament or I tear disc. You know,
Sure.
I don't have that elastic, shock
Elasticity.
absorbing type
Mhm.
thing with my connective tissue. So I had to try all kinds of treatment modalities. I'm like, this doesn't work. This doesn't make sense. You know, and the role of the practitioner, you know, I underwent Rolfing, and I went back. I said, well, I still hurt between the shoulders. Oh yeah, I took care of that. I'm like, excuse the hell out of me. I'm the patient, and I feel that. You know, and I always thought that my job as a practitioner was to find out if my patient does not belong in my clinic,
Mhm.
if they need another line of care. And I do referrals, and I'll reject people from coming to see me. A woman wanted to come see me from Texas. I read her that I had to fill out the paperwork first, send it to me. I said, I'm happy to see you after you see a rheumatologist.
Mhm.
She was disappointed. She went to the rheumatologist. She had a inflammatory spondyloarthropathy. There was no reason to get on an airplane and come see Jerry Hesch.
Got
So
it.
I'm very careful about who I take on.
Yeah.
And we have a few
think
unhappy
that makes
campers. 1% or 2% are unhappy.
Yeah.
They walk in the door unhappy. They leave unhappy. You know, but I
Sure.
do work with the chronic pain population.
Mhm.
Most of my folks have had pain for a few years, and they've really been around the block. And I know when it doesn't work. You know, I
Yeah.
have that humility.
Yeah.
I have an enthusiasm for the biomechanics, you know, so
Sure.
I wax poetic on YouTube,
Yeah.
and I get told I have an ego as big as a house, and I'm like, well, what kind of house? You know? And my retort to that is people with big egos make big accomplishments.
Yeah.
They're not feeble. So whatever big ego I have or don't have, you know, I do just fine.
Yeah, and I think the word should be out there. I think people need to know about this.
Yeah,
There's so many people
I will
with
do a
chronic
book
pain.
this year. I will
Yeah.
write a book.
So more people need to know and have the opportunity to see someone
Yeah.
that is skilled in this work.
And, you know, yeah, and they say, oh, he named it after himself. He has a big ego. He calls it the Hesch method. I'm like, well, it's no other method, and I developed it, and
Yeah.
people who design, you know, stuff in the world give it their name. But I'm sorry I didn't die yet, because I guess sometimes you're supposed to die first, and then they call it the Hesch method, or, you know, sorry, I'll get to that.
Yeah.
I'll get to the die part later, you know. But it's unfortunate when that is a barrier to somebody learning.
Yeah, yeah.
That should not be a barrier.
It should not, no.
And
I think people get stuck on semantics.
they
and-
do.
Things like
And
that.
people want to be comfortable with what they're already doing. So
Yeah.
when you present something different, rejection is the first
Mhm.
thing coming out of the chute, you know. And I had to develop my work. I didn't develop this. I was so timid.
Mhm.
I didn't develop this to go out into the world and teach. That wasn't my intention.
No. Huh. It's just
My
a clinical,
intention was
just a
to
clinical practice.
understand the body and to be able to treat it in a way that made sense to me.
Mhm.
So after work, I go swim, I go to the library, read the literature, try this, try that, experiment, and you know, like with the pelvis, it's like, there's still something wrong. That ligament is still tight for a reason. Why? And I trusted my hands, and I have great palpatory skills. Sorry, it's true. Sorry if that bothers you. And I trusted them, and I would go home and restudy the anatomy and say, well, what could be tight? How could it move?
Mm-hmm.
you know,
Yeah.
and discovered 18 movement patterns in the pelvis that are not in the literature.
Hmm.
And it is what it is.
Yeah.
You know, I had to treat myself, and if I wasn't who I am, I would be medically disabled right now. But because I'm able to treat myself,
You keep yourself
I
functional.
keep myself in good shape.
Yeah.
I'll get in trouble when I go put down 40 bags of topsoil. Yeah, I get in trouble, but I know what to do. It's one of several permutations, and I go through each one of them and find out what's going on with my body, and I correct it, and bingo, I'm good. So I developed this out of needing to understand the body and needing to have a way of treating it that made sense and that was effective, not, oh, well, it takes a long time to get better. You've had it a long time.
Yeah.
And that just means they don't know what they're doing.
Right.
You know? And I was also disabled, but working in profound pain. And so a lot of these techniques were hands-off. Okay? Everything with you is hands-on today, but for many types of restrictions, it's hands-off.
Oh,
you know? And because it had to be. I just couldn't, impart large force, any force into the body. And so for every mobility impairment in the body, I have a self-treatment.
Oh, okay.
Okay? And so there's a whole program for everybody. I had a massage therapist, had a car wreck at age 19, for 30 years would go to the chiropractor or osteopath once to twice to 3 times a week.
Wow.
She said sometimes I leave the office and I already feel out, whatever that is, that sensation of something's not right. And it, drove her a bit, really bothered her. And I treated her in 2 visits, so I charged less than 1% of her cash outlay. She said that she had spent $50,000. Wow. So if she lives another 30 years, I've saved her another $50,000.
Wow.
And my follow-up with her 2 weeks later was, every once in a while it feels like it's headed that way, but I know exactly what to do to manage it. So my goal is to make people independent.
I think that's fantastic.
It's not. My wife hits me on the head with a frying pan every night. That's a bad business model, Jerry. When are you going to fix that business model?
And I think a lot of times people have something, especially in the chronic pain population, where they almost feel as though no one believes that they really have something that's slightly out or it's there, and they're seeking treatment, and they never get the correct analysis.
Right,
and the
I get it. Nothing goes out. There's no subluxation. It's a kinesthetic sensation, but it's an unpleasant one, and it does create focus, and it does contribute to pain. It does cause nociception.
Yeah, absolutely. I mean, I could tell such a big difference in my pain level walking in today versus now.
Great. Yeah, so you have significant pain reduction.
It's significant, yeah. So it's
and I tell people, I said, you know what? When I do as much work such as you had a lot going on.
Yeah.
I tell people, I think that you're going to be more alert throughout the day because your brain isn't, parsing the energy for the pain. And I think you're going to find out that instead of being exhausted at 9 o'clock going to bed, I think you're going to find out that you're up another half hour. And I think you're going to have better more restful, restorative sleep. And you might wake up a half hour earlier.
Wow.
Doesn't always happen that way, but
I'm looking forward.
For some, let me know. I'd be curious to know.
I definitely will.
Yeah. And I'm a one-man band. I get it. I've had some help from some people, but we need much more help.
Sure.
And I can't bear the burden myself. It's not all on me. Okay. No one out there who has brought a work forward did alone.
Sure.
Okay.
Yeah.
And I can't either. And I'm busy enough in the clinic and family and all that stuff. So, but I will be putting more effort into getting research on this work and bringing the work more forward.
Yeah, I'm looking forward to learning more about it so I can help my patients with it.
Nice. Well, anything else? Any final thoughts?
I think that's it for now. Yeah, I'm just very happy and curious.
Good.
And just grateful. So
So as a PT, you found it helpful to work with someone who has an ego as big as a house?
I don't know. I didn't see that.
I know people that know me say that I'm
Yeah.
humble, but
Yeah,
people
I think
that
you're
are the
humble.
keyboard cowboys, they
Yeah.
they do that kind of
They hide behind the
characterization.
monitor. Yeah.
Anyway, thank you so much. I appreciate you sharing your thoughts.
It is my pleasure. Yeah. Thank you.
Yep.